I think the most important will be the plenary session today. That is called the CHAARTED study. It was done in my capacity at the Nevada Cancer Institute, and then when I moved over to US Oncology, I continued doing that work. That takes men who would be normally treated with just a drug called Lupron. It's been around forever. And Lupron supplanted supplanted surgical castration for the treatment of prostate cancer once it spreads outside the prostate. And that's been the standard since the 1940s. And we've tried to improve upon it with pills and so on, not really getting much improvement. There were at one point there were like 30 different research studies trying to show that a pill improved Lupron, and it really was not much of a benefit. So then we decided to add chemo. Dr. Sweeney, who was at the time at Indiana University, is now at Harvard, ran the study, and we took about 800 patients who were going to get Lupron. They had to have it in their bones or in their lymph nodes or liver or lung. And some of them had been previously treated, but most walked in the door with cancer like that. And we gave half of them chemo along with the Lupron and half of them just Lupron. And lo and behold, those that got chemotherapy earlier lived a lot longer, almost a year and a quarter longer. So the benefit of 6 doses of chemo was obvious, and that is one of the top 4 advances here at ASCO. The side effects were relatively modest, even though this is an older population. And it's an older drug. It's not a brand new drug. It's, like, what do they say, teaching an old dog new tricks? That's all it is. Sometimes the best research is the simplest. And that's what it was. It was just a matter of taking a standard and putting another drug on top of it. And that really will affect the way I think most oncologists think when they see these patients. They'll see a patient walk in the door with cancer in their bones, and now they have to think. They should get Lupron or Luprolide. It's not, Lupron is a brand name, Luprolide is the generic. And they should either get Luprolide or they should get Luprolide with chemotherapy. And now I think they should get it with chemo.